Mhm. Folks, I want to let everybody know we're delayed about 10 minutes. They're trying to close another committee, and some of the members on this committee are in that committee. And so as soon as that committee closes, then we will start up. Okay. I'd like to call the House Health Full Committee to order. Will the clerk please take the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall, Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry. Mr.
Okay.
Chairman, you have a quorum.
All right, thank you. And do any of our members have any personal orders? All right, seeing none, we do have 4 items on the calendar. We're going to do some cleanup here. So without objection, House Bill 2778 is off notice. And without objection, House Bill 2779 has been taken off notice. That brings us to item number 1 on the calendar, House Bill 946. Chairman Ramsey, you are recognized.
And thank you, Mr. Chairman, ladies and gentlemen. I regret that I was instructed by the party bringing this bill to me, the Tennessee Charitable Care Network, that they requested that I take House Bill 946 off notice. The legislation was misrepresented and pulled into an anti-vaccine movement wrongly. We all need to be aware, including those working against the bill, that hundreds of young people will not be able to discuss preventive measures for STDs with healthcare professionals. So, Mr. Chairman, I would request that this bill be taken off notice.
All right, without objection, House Bill 946 is off notice. That brings us to item number 2, House Bill 2535. Representative Alexander, you are recognized. And there is an amendment, I believe.
Sorry, I'm not on.
Okay, does this amendment
Thank you,
just add to, or does it rewrite?
It does. It adds to it.
Okay, do you want to discuss the bill and then have us discuss the amendment,
It
or
really just makes the bill, I think.
makes, okay, go ahead. Let's go ahead and okay, drafting code 014796. Okay, you have a motion, a second? Okay, you are recognized.
Thank you. This bill as amended ensures the right to the end-of-life visitation during a disaster or a public health emergency for COVID-19. The amendment 014796 makes the bill and removes a specific requirement to provide a negative test to visit. Nursing homes must always allow indoor visitation as it is a resident's right. The federal government closed facilities to indoor visitation for more than a year during the pandemic, but still allowed the end-of-life visitation. Prior to COVID, nursing home visitation has always been open. Nursing facilities are now largely back to normal. Facilities cannot limit the frequency and the limits of the visits, the number of visitors, or require advanced scheduling. Facilities must always allow end-of-life visitation. Visits must adhere to the CMS infection control protocols like hand washing, face coverings in the common areas, as well as other required safety protocols. Resident safety and preferences must also be respected.
All right, do we have any questions on the amendment? Okay, Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. And this is just for nursing homes and assisted care living. This is not hospitals, right?
It is not. Thank you.
Thank you.
Okay. Any further questions on the amendment? Okay, seeing none, we are voting on amendment 014796. All those in favor say aye.
Aye.
Opposed, ayes have it. We are back on the bill as amended. Any questions for the sponsor of the bill? Okay. Seeing none, we're voting on House Bill 2535. All those in favor say aye.
Aye.
Opposed, ayes have it. Bill goes on to calendar and rules. All right, that brings us to the end of our calendar and to the end of our work for the or did you want to be recognized? Chairman Woodson, you're recognized. Oh.
Go ahead. Well, now that I already brought it up. Chairman Terry, I think I've been on health committee with you since I first got elected here. And I just want to tell you, I always enjoy working with you, and you take time to meet with members when we have questions. And I just appreciate your leadership. In the Army, we call it good command climate, and we have it. Thank you.
Yeah.
Thank you. Appreciate that. And with that, I would like to take a moment and thank the members of the committee and appreciate the committee for the work that the members have done this year. We've had COVID impacting our nation and our state, and we've had been in the midst of some big issues that we've had to deal with as a committee. And I just want to thank the members for the dedication and then their work for the betterment of the health of the state of Tennessee. I'd also like to thank our committee staff, have Harris King, Rajul Bajoy, and Zach Brown, and Megan Dix. Also like to thank our clerks, Natalie and Alexa. I'd like to thank our Sergeant at Arms, Terry Van Treese and Thomas Woodward, and our health committee interns, Nick Jordan and Josh Say. And it's been an honor and a pleasure to work amongst all you. Chairman Ramsey, you're recognized.
Oh, I just wanted to echo your thanks to the staff that we had. They've worked well with me, your subcommittee chairman, and I appreciate so much your diligence and attention, your focus on all these bills. This committee has done a huge amount of work, and I appreciate you so much.
Thank you. As the members know, at the end of the session, there may be bills that get double referred or something may get sent to us. So this may not be the last time that we meet, but it may. But again, I wanted to thank everybody on the committee and thank those in the audience and those watching at home. So with that being said, we are adjourned to the call of the chair.